Thank you. The minutes of the previous meeting, do you all agree with them? Has anyone got any comments they want to add on anything? Thank you. Right, we come to item 4, which is the COVID update. And this meeting, we do have Dagmar. Thank you. I welcomed you last time and it wasn't you. So Dagmar, over to you. Thank you.
All right. Good evening, and thank you very much. Councillors, if you allow me, you've got slides in your pack, but because Omicron is such a changing picture, they are pretty out of date. So if you allow me to give you a verbal update, would that be acceptable? Yeah.
Yes.
Let me start. Infection rates, as you are well aware, have been really high. London was leading in the UK. That was particularly the case over Christmas and the New Year period. You will have heard 1 in 10 was the sort of community transmission rate. The good news, cautiously optimistic news, is that since then, daily infection counts have been coming down in London. Now, I say cautiously optimistic because you are aware that testing has changed. So people are not required to do a confirmatory PCR if they had a positive LFT. And we are still not 100% sure whether there is some element of the change in testing responsible for the leveling off of infection rates. But all in all, as I said, cautiously optimistic. In terms of age groups, we're in the children's scrutiny committee. Before the holidays, all through the late autumn, you will be aware, we had really a lot of outbreaks in schools and very high infection rates in children and young people. That was mainly the Delta variant. Omicron took over at the beginning of December and very quickly spread into young adults and then working age adults. We had a really concerning surge in the over 60s as well over Christmas, but that is fortunately leveling off. So what we are now sitting very tightly on is what is going to happen to children and young people as schools have opened up. It's early days, so too early to say. There's a bit of uncertainty whether the Delta variant has given sufficient immunity to our young people in schools, or whether Omicron will still cause lots of infections in schools. But in a way, we are prepared to step in and support the schools. The important bit, as we've always said, is how serious is the disease, and our marker is hospitalizations. So hospitalizations have been up in London, but they have been up with COVID, reflecting community transmission rather than because of COVID. So people who had whatever broken their arm were found to have COVID, but people who came in because they were short of breath and had COVID were much less. So the disease severity was much less. And that is reflected in the ITU bed use and the use of ventilators, which has been steady. So what is important, though, to understand is the NHS is under serious pressure and continues to be under serious pressure. And that is due to staff absences, because obviously with the community transmission being so high, that affects staff. Then infection control measures also make it more difficult for the NHS to run smoothly. And then finally, vaccination. As you're aware, there was a booster sprint before Christmas and up till New Year, and a lot of NHS staff helped with this endeavour. So really, really important for all of us, including our schools, our young people, our parents. The message continues. Vaccination is our best tool. It is our best tool against Omicron, despite Omicron not being that severe, it is still very helpful because we think vaccination definitely prevents serious disease. And it might be that Omicron appears less severe because so many people now have some immunity, either acquired through infection or through some vaccination. So very important, as I said, before Christmas and during Christmas, it was the focus on the boosters. That was mass vaccination sites, but it was always open to everybody. So families actually turned up, and we were very, very pleased because we had quite an uptake as well of first and second doses, not just boosters. But now, after the holiday periods, the focus has really changed. It is a much more targeted approach, leaving nobody behind. And that means there are pop-up clinics, and we are planning with our primary care and NHS colleagues where best to go. And community venues, so much smaller numbers expected to be vaccinated, but very, very important, meeting people where they live their lives, where they're in trusted community venues. And really important, therefore, are schools. Obviously, as you're aware, the 12 to 15-year-olds, the uptake is still, even for the first dose, not satisfactory. It's under 50%. Merton is just the same, like everybody in London, and also nationally, we have been struggling. So we're not repeating that every school is offering the vaccination again. It was quite disruptive for the schools, but some of the schools have volunteered their premises to be hubs. And so we are working again with the schools and with our NHS colleagues, and indeed with community representatives, our young people, to find sites and ways to ease and improve access for 12 to 15-year-olds. As you will be aware, the 12 to 15-year-olds are now also due for a second dose, but because you need to leave 12 weeks in between, there's obviously a bit of a staggered vaccination progress. You will have also heard that the 5 to 11-year-old at high risk, the Pfizer vaccine has now been licensed. That vaccination program has slipped a little bit and is now planned for Easter. If I then move on, just one other thing to let you know, just before Christmas, on Christmas Eve, we had to put an application into the Department of Levelling Up Housing and Community for vaccine champions. We were successful, so £485,000, which we are absolutely delighted because we are planning very much with our community partners to really focus to leave nobody behind, and that includes, very importantly, families, parents, and young people themselves. In terms of schools starting again, they have been fantastic. They are real allies now. As you're aware, there was a big testing campaign before kids came back. Schools have done that. The secondaries had staggered starts. So far, so good. There is pressure on the schools, there is no doubt, particularly staff reflecting community transmission. It is tricky, support staff, supply staff, all very short in supply because of sickness. We're ready to support as we can, and obviously real push to continue as much as possible with face-to-face education. I think that's me as a summary.
Dagmar, thank you very much indeed. And I know it's difficult because it's constantly changing, but we do appreciate the weekly input you send out to members. Thank you. Has anyone any questions for Dagmar? Anyone in the room? Is there anyone on the Zoom?
Yes.
Right, we'll take Omar first. Thank you.
Thank you, Dagmar, for your update on the situation with COVID. I know I've previously asked this question before, but do we have a breakdown, or do we know whether there's a greater reluctance amongst children from the BAME background?
Thank you for the question. And indeed, we have looked at it, and we have got some data. Because numbers are quite small, when you split up our children between 12 and 15 years by ethnic group, there are some limitations on data sharing. That is why I couldn't put those data into the public data set. But what you will have in your data pack, and it is slide 13, that we are giving you the breakdown generally of ethnicity and vaccination. That's one slide, slide 12. And then probably the more helpful one, we've now got 12 to 15-year-old by East and West. Now, it is still not exactly answering your question, but because we know that in the East we have a lot more ethnic minorities, particularly children and young people, I think it is a very likely and plausible explanation that our children from ethnic groups have lower uptake, because you see the East-West differential is really marked. We have, as I said, we were working closely with our NHS colleagues. The health and well-being subgroup is particularly focusing on vaccination equity, as you're aware, and we had a specific session with more granular data. As I said, because of small numbers and data protection, we can't share them publicly, but we are using them to focus our effort into communities with particularly low uptake. And really the important thing is then to go out and listen, and not fall back to and think you know all the answers, but really tune in and listen what the reasons are. And there are quite a variety of reasons. There isn't just one. So we are trying with a very bespoke pop-up approach to make the access as easy and attractive as possible to our various communities, including ethnic groups.
Thank you. Has anyone else got a question for Dagmar?
Yes, thanks, Chair. Thanks, Dagmar. Thanks for the presentation on the vaccination. I just need to know the program of vaccination of second dose for the year 12 to 15, please.
Yeah, so there isn't really a problem. So it is simply the policies only just rolling out. So initially, the JCVI, which is the Joint Committee for Vaccination and Immunization, had only licensed the vaccination for the first dose. It was a very cautious approach. Now they have licensed it for the second dose. And for children and young people, so everybody 12 to 15, there needs to be an interval of at least 12 weeks between the first and the second dose. So because we've only just, in a way, gone round to offer the first dose in December, a number of children are not yet eligible, but we are preparing so that we have a rolling program for those who become eligible for the second dose, that they have no problem in picking it up. But that is the reason why the second dose is still very low. It's simply because the kids aren't yet all eligible.
Thank you. Thank you.
Thank you. Has anyone else got any questions? Anyone at home on Zoom? Dagmar, thank you very much. And I know it's an awful lot of work, you keeping on top of this, but we really do appreciate your keeping us all informed. Thank you very much.
Thank you, Chair. Bye-bye.
Bye-bye. Item 5 is the business plan update, and that's from Caroline Holland, Director of Corporate Services. So Caroline, I have looked through read every word but I still look to your guidance, please. Thank you.
Thank you, Chair. I'll test you with what's page 397 of the information pack, but all right. So I came to Scrutiny last year to give you an update on the MTFS and how we had rolled it forward. Subsequently to that, we had Cabinet in December where we brought forward the savings after we had set those savings targets. So those are now set out in the information pack, which members would have got, I think, sort of last week, but is also on the agenda for you in front of you tonight. We've also set the council tax base, which has shown an improvement in council tax income over the 4 years of the MTFS. And subsequently, that's meant there is a change in the use of reserves because we've got additional monies over and above what we had the gap when we sort of brought the MTFS gap forward in November. The information pack has the detail of all the savings. So if you have the chance to look through, you can see what the other panels are looking at. And we have the summary of the savings on page 9 for you, which shows the level of savings that have been brought forward, totaling just under 2.5 million. We also have the draft equality assessment, so I'd welcome if you do have any comments on those, and the summary of those is on page 29 of the information pack. And what we have done also is done a summary of the outcomes. So there are 25 with an outcome 1, which is the least significant outcome of an equality assessment, and 7 have an outcome of 2. So I think sort of some real progress being made in the savings that have been brought forward for you this evening. We also have draft service plans. Again, we've done a light touch approach because we are conscious that with the outcome of your Merton consultation and the change to the strategic priorities and objectives and principles, that we will be looking to do something more fundamental next year. So there has been a light touch approach, an update of the performance indicators within those, and they'll be used as the basis for your monitoring during the course of 22-23. We have also listed the details of those savings that were deemed to be unachievable, which is based on the position at month 4 of the monitoring during 21-22. We will be bringing to Cabinet on Monday night some further updates on the MTFS, particularly in relation to the outcome of the settlement, and I can give you some headlines there. So it's in some ways fairly positive news for us, but it was only a 1-year settlement, so that has still left us some challenges and some issues still around when we're going to know about the outcome of the fair funding review, what it means for the business rates reset. There's going to be a business rates revaluation every 3 years, but we still have some outstanding appeals from the 2015 business rates reset. So it's still not going to necessarily make it much easier for us going forward. There were some additional new grants. So we have a services grant, which would be sort of 2.5 million, which we have built in. And there is a cost of care grant, which is to deal with the fair cost of care fund. So the changes that the government are bringing in from 23-24. So we've got some preliminary monies to help prepare for us to know about those people who will be subject to a cap on their overall pay for the cost of care. It is not any monies to deal with additional demand. So we are still lobbying hard with adult colleagues for further funding there. There is an update on the Freedom Pass and an upside of COVID, if I can actually say that, is sort of in some ways been the reduction of transport users, and therefore that has meant a reduction in the cost of the Freedom Pass. So a benefit of just under 1.8 million for us in 22-23. And therefore there will be some further changes in that balance in the budget reserve, but more will be sort of slipped into 23-24 to bring down the gap there. So we will still have a balanced budget for 22-23, but the size of the gap in 23-24 and 24-25 onwards still remains in flux, shall we say. Clearly, we've got the February Cabinet paper, and we do hope to bring an update then on the outcome of the safety valve discussion. So, A, whether we are successful or not in getting any funding from the DfE towards our DSG deficit, and B, what the level of that funding will be, and then C, the phasing of that. So that's the challenge for us, in that we don't know when, what, how, and obviously there's going to be some serious significant targets for Jane and her colleagues to achieve, to make sure that we get the funding on an ongoing basis. We feed in some of the analysis of our business rates, so the outcome, we call it an NDR, so our National Domestic Business Rates. So all the assumptions around the appeals, the bad debts provision, collection rates, that were based on information at the end of January. That's still also to be fed in. So still some further work that will come in February, but hopefully an improving position at this stage with regards to the gaps on the MTFS. Happy to stop there before I would hand over to Jane to take you through the details of her savings, which are on sort of page 16 and 17 of the information pack. Thank you.
Thank you very much, Caroline. I'd also like to ask Councillor Byers, he might want to come in, but do you think it's the best order for Jane to come in first, because we're focusing particularly on that area, and then Tobin, if you wish to come in after Jane, is that all right? Any contribution? Jane, thank you.
Sorry, forgot to unmute. So the savings we've got planned for 22-23 and 23-24, which you'll see outlined. So certainly the savings for next year are very achievable, and also, as you'll have seen from the equality impact assessments, are not stopping delivering services to young people, but are more streamlining activities. So for example, in education inclusion, one of the reasons we've been able to streamline activities is that some of the services we used to deliver face to face, we're able to deliver some of those online and make some savings in some of those, and some of those for young people are working better than they were online. So we've got a hybrid, a mixture, so a cost reduction there. We have some office efficiencies. We have less people in the office, spending less on printing, and so on. And then also we've got a saving that's attached to the direct procurement of services in relation to the PFI contract. So that's where we are directly delivering some of those services previously that were more expensive through the contract. And then the saving that's outlined for the following year, for 23-24, which is in relation to children's social care placements. So that's, as you can see, we've got a lead into that, but that is around our demand management and commissioning. So tighter commissioning, and also working with a Pan-London piece of work that's looking at trying to reduce the cost of that commissioning and bring some of those placements in-house, so that will also be sort of less, it'll be more cost effective. So I think that's the summary of those new savings.
Thank you. Tobin, do you wish to come in at all?
Thank you, Chair. I don't have anything specific to say over and above what Caroline has said. I think she's set out the position. I would just like to thank Caroline Holland and Roger Kershaw particularly for all of the work that goes into getting the business plan to this stage. There is still a little bit more to go, but I do want to put on record my thanks to them, because they do work incredibly hard. But primarily I am just here to listen to colleagues' views, and obviously with Councillor Stringer, very happy to answer any specific questions to her or I. Thanks, Chair.
Thank you. I want to take questions, and can I say, I know sometimes people have asked a lot of questions in one go. If we can initially restrict it to a couple of questions each, so we can get round as many people as possible. And I want to make sure if we can have Hayley first, then Dennis, then James. Is that all right? Is there anyone else who at this moment wants to ask a question? I'll always come back to you. So if you could just keep it to a couple of questions initially, I will come back to you for more, because the budget is extremely important. Thank you. So first of all, Hayley.
Thank you, Chair. I do have in total 4 questions, but I will limit it to 2 for now, listening to what you've actually said. That's okay. So when we have gone round, if you wouldn't mind coming back round to me. So Caroline, Jane, Tobin, within Appendix 1 of the smaller pack here on page 45, within section 2.1, and it says savings not achieved. It says page, so that's page 45. And within that table, which is a table at the bottom of the page, it's got target savings 2021-2022 of 1.46 million. But the projected savings are 410 with a shortfall of £1,050,000. And I'm wondering why that was, please. So that's my first question. My second question, on page 47, you do mention the DSG, and I've also obviously clearly read Jane's report as well. I was wondering if we could have a further update on the safety valve intervention discussions, please. If there's anything else that can be added over and above what is actually in Jane's report. Specifically, have you actually spoken to other councils who have been successful with the safety valve discussions? Because within Jane's report, it mentions that the government will provide funds to shorten the DSG deficit. So I'm wondering what your expectations are should everything go well and the Department for Education, gives the green light. So that's my two questions, please, for now. Thank you, Chair.
Thank you. Caroline, do you want to, as people are putting forward two, do you want to take those and with Jane and perhaps Tobin coming in two at a time? Or if we have 6 questions, it might be too much. So if you'd like to take those two, is that okay? Thank you.
All right. So the savings not achieved. So as part of the monitoring report that we bring to Cabinet on a monthly basis, we do regular monitoring of savings for 2021 and 21-22. Because of the impact that COVID has had on residents, on services, and on staff's capacity to be able to deliver some of the savings, it was recognised that savings were less likely to be delivered than in previous years. So as reported the last scrutiny round, we had taken the decision, not lightly and very unusual, I'm sure my CMT colleagues would say, for us to then say, okay, these savings, you are struggling to achieve them this year. Normally, we would say, okay, if you want to almost swap them out and bring forward new savings, then do that. What we've actually said this time around is that you will not need to find these savings for replacement savings because of the challenges to be able to bring forward new savings, particularly for 22-23. So the detail of those savings is set out in the information pack on 26, 27 and 28. But it's part of the, as I said, that regular monitoring that's part of month 4. There have been some changes subsequently, and we will be, as part of the year-end process, looking to see whether some savings that more has been achieved or less has been achieved. But I think the one in particular for Jane's area was Public Health Commission services. So you've heard the challenges that Dagmar and her team have been under, and in particular the pressures on Jane, her team, school places and SEN placements. So there was difficulties in being able to do that. So we took the decision corporately and to build it into the budget that those savings would not be achieved this year. But we will keep under review and regular monitoring all the savings that are coming forward to be delivered on an ongoing basis. So this is almost in our response to help departments and services and residents through COVID for the savings reversal this time around.
Thank you. Dennis, how many questions do you have?
Oh, there was.
I did. That's two. That was the answer to my first question.
Oh, sorry.
I beg your pardon, sorry,
Hayley.
Chair.
Yeah.
I think if I let Jane start off on the second one, and then I'll come in at the end if needs be.
Okay, so I think our expectation. So we've gone through the process of, if you like, support and challenge, which I think involved quite a lot of challenge, but also some helpful support from DFE colleagues around pulling together our proposals for the way forward. And we obviously, you'll be aware, we outlined the sort of from a sort of strategic point of view, the key areas we were going to look at in terms of trying to achieve those savings. And I can sort of, I guess, remind you of some of those. So that was around really enhancing our inclusive practice in mainstream schools. So trying to reduce overall the number of education, health and care plans, making more specialist provision locally so that we reduce our reliance on the independent sector. So we've got already plans in place to expand specialist provisions. That was already there and is part of our plan, and we've increased that with, as part of our plan, the need for a bid for some capital funding, sort of strengthening our oversight of commissioning in independent and non-maintained schools. So that's a combination of reducing the reliance on those places, but also really contract managing and ensuring that we're commissioning those places effectively. Putting in additional support to avoid case escalation, so around the annual review process, and having that kind of pervasive financial strategy that connects everything from a case level to sort of wider decision making. So that was the kind of basis of the plan we put forward. Our basic principles were agreed with. We provided assurance to colleagues that we'd discussed with schools forum, with schools more generally, what that plan was going to be, that we had obviously had work to do. It's a challenge, but they felt that the plan we had in place strategically was right. And we then had to provide lots of information from a financial perspective about how we might expect to achieve those. But as Caroline says, what we don't know at this point, so if you like, we've made an ask of them. We've said what we will do. We've committed to put additional, and again in these papers you'll see we've committed to put additional resources in to enable us to deliver that plan in the form of additional staff who will be helping us with who will run the whole. So it's effectively permanent staff that will support us for the 5 years of that programme to deliver it. And so what we're waiting for at the moment is that them to feed back. So we put those plans in, the advisors agreed that plan was a plan that they could support, and we are waiting for a response from the Secretary of State to agree that. And at the point they agree it, what we know from other boroughs is that they will then say what money they might agree to give us, and the sequencing in which that money will come. So whether it will be front loaded in the first years, and we get that's kind of what we would expect. We expect to get more in the first years and then for it to taper off, but for it to run for the full 5 years. So they were clear they're going to want that, if you like, skin in the game for the full 5 years, so they can work with us to ensure that's being delivered and monitored. So at this stage we're not completely clear and that's why it's quite difficult to plan from a financial point of view. But yes, we should know by the middle of January was the timescales they gave us. We should get a response, but because part of the plan also enables us to put in for a capital bid, we have already been informed of the process through the safety valve from which we can, if you like, at an early stage apply for that capital bid. So we've already put in an expression of interest that we will be putting in a capital bid, and we've got until March to complete that process. So hopefully that helped, Hayley. It's sort of in outlining sort of what we're expecting at this stage.
Thank you. And Hayley, I put you down to come back again and ask questions. Dennis, how many questions? Okay.
Yes, my first question is a general point on the figures in, I would assume, across the council are like for pay inflation, price inflation, are set on a 1.5 basis. Are we sure that this is going to be a realistic figure to base our finances on? As at the moment, I understand, and I might well be wrong, that the inflation rate is 3.2 at the moment. Are we confident that's going to come down and we're going to be able to live with the figures based on 1.5? My second question, and it comes back to the one I asked at the last meeting about direct schools grants. Now, the figures in this agenda and the figures in the department update are fairly similar, but we have what is funding services overspend of £12 million plus. We are, I assume, looking at a way of dealing with that. But if the 5-year period mentioned in the department update, and we've got to pay that money back or at least deal with it, that's fine as long as the money that's coming in and the call on the services are fairly stable. But judging by the last 2 or 3 years, the need for that grant has risen and probably will keep rising. How do you propose to deal with that?
Right. So if I start on the inflation. So on page 82 and 83 of your pack, we have actually revised the level of inflation to 2.5% for 22-23. You're right, sort of CPI and RPI is slightly higher than that at the moment. So what we have also done is increase the inflation exceeding 1.5%. What we will look to do is for those areas where there are significant contracts, where the renewal is based on RPI in the coming few months, to see the value of that and if we have an issue with the level of inflation we've currently provided for. So we will be keeping that under review. Not all areas of service expenditure is subject to inflation increase, and therefore we never fully provide, and we normally don't have too much of an issue. But as we do say, these are unprecedented times, and we are keeping a very close eye on it, and particularly around sort of the utility and energy bills in particular. So gas in particular, we are looking to see how we can sort of either reduce the reliance on spot purchasing and making sure that we sort of almost hedge what we're looking to buy demand-wise as we go forward. So that's been an approach that we've changed in response to the current increasing levels of high utilities in particular. I'll hand over to Jane for the second part, but come back in the end if there's still some issues around budget-wise generally.
So part of the plan, so the rebalancing actions that I outlined in answer to Councillor Omra's question are what we're putting in place to bring the in-year deficit in line over the 5 years. So the plan consists of 2 parts. One is what we're doing to balance in year, to bring that back to a zero, so that it's meeting. We stay within budget in year, and so all the actions that the rebalancing actions I described are what we are doing to bring that back in line, and we can do that. Our plan means we can do that within the 5 years. And then the second part of the work that's needed is to get rid of the historical deficit, and that's a combination of. That would be a combination of some of the council's funding, which Caroline will probably want to outline, and also our request from the DFE, our hope from the DFE that they would give us some funding towards that rebalancing of that historic deficit. So I don't know if there's anything you wanted to add there, Caroline.
So I think part of the challenge is that we have to have a nil deficit at the end of this process if we're successful with the safety valve funding. Slight change from the parameters when we started the process, because we thought they would help us reduce our in-year deficit, but they were very clear by the end of the process that they want our deficit to be nil. So currently, with the assumptions that we were working on, our deficit was going to be 58 million by the end of those 5 years. So that's why it's not straightforward as to they'll give us all of that money. So we've got to put some significant sums aside to actually bring down that deficit as well. So that's why we just need to wait to see how much the DFE will offer us. And then they've made it very clear that it's almost performance related. If we do not achieve the targets they've set, then they will not give us that further funding. So those are the challenges in trying to see the monies that we had set aside previously were to offset half of the deficit. So there has been some increase in DSG grants above the levels we had previously assumed, but still nowhere near enough to meet ongoing demand, increase in demand. So it's very much a moving piece. And once we get some information back from DfE, we'll then try and set it out clearly for you, because it's going to be a challenge for us as officers to work our way through it, to then also then help you understand, because that's still going to be something you'd be very interested in, to make sure to see how we can achieve the ongoing monies. The DfE were very clear that they did not want to give us any funding over a short period of time. They wanted to make sure that they could keep us under review and make sure that we delivered, to make sure that they could then ensure the funding was delivered according to targets over that 5-year period. So, but we just need to wait and see what they come back with.
Thank you. James, how many questions might you have?
Chair, thank you very much. So, well, one comment and 2 questions. I was also going to raise the issue, as Hayley has done, on the savings and the fact that 72% of savings have not been met. And I understand circumstances change, and that's been outlined to us. And I understand that 1 or 2 issues arose, and they are important, and that will happen. But nevertheless, obviously, the key is that officers are able to, as far as possible, predict those changes and also stick to savings that has been agreed, because it obviously doesn't read very well that 72% of savings were not met. Chair, my 2 questions. The first is on the transport, SEN transport consultation. I see that consultation has been completed. Given the potentially significant impact on the budget and the fact that over a number of years I've raised it as being something that needed to be looked at, I just wanted to ask why we haven't been able to have that as part of tonight's meeting, because it could be very useful in terms of determining the financial position and scrutinizing the potential financial position. So that was my first question. My second question is on page 47. Am I right? Question to the 2 directors. Am I right that a lot of what we've heard this evening is on the assumption that the government do support the safety valve? So my question is, are we at the point where we know that will happen because they've encouraged us to bid, or am I right that there's still an element of doubt? I mean, clearly it's in Merton's interest that they agree, and I hope they do. So that's part of that question. And the second part to the 2 cabinet members are on page 47. It does say that that Merton has one of the highest percentage deficits in the country, and just above that it says that the size of the deficit is increasing year on year, and without further government support will continue to grow. And I just wanted to ask what the 2 cabinet members thought of that comment. That the deficit will continue to grow without government support, and whether that is wise. And I previously said to Councillor Byers, have you had discussions as to what would happen if the government didn't support us? And at the time, Councillor Byers said that he had those discussions. So Chair, a bit for the directors and a bit for the cabinet members, please.
And thank you very much, James. Yes, the SCN is due to come up. We are getting feedback at every meeting and a departmental report from the director, and it is coming up in the following meeting, but certainly. So I don't know which order we want to take that in. I think if Caroline and Jane deal with perhaps the first one first, and then go on to the second one with both Tobin and Eleanor coming in as needed. Thank you.
So if I pick up the transport review, so the transport consultation ran until the 5th of January. So at the time we were sending these reports out, that was when the consultation ran until. So the reason there isn't an update on that consultation here is because we are just analysing that feedback around transport, and there is a report coming to the next meeting to look at that in detail. So that's the timing for that one. And in terms of the DSG, I suppose whether we expect it to. I mean, all we can say at this point is we went through the support and challenge process, and the advisors who worked with us through that process were recommending the plan to the Secretary of State. And so I suppose on that basis we're hoping we'll be successful, but we won't know until we've been told that.
And if I can just then follow on from Jane, so the numbers within the current MTFS assume no change from previous assumptions. So we were still looking to offset the deficit because we're not allowed to put monies in without the Secretary of State's approval. So we were offsetting the deficit with monies that we set aside. And therefore that's why it's crucial, because whilst they were recommending to the minister to to give us some support, we don't know what level of support they were going to give us. They wouldn't tell us how much money they had available for the 6 authorities that they were working with. We still don't know who those 6 other 5 were, and we don't know if the other 5 got to the stage that we did. We did know at one point when we said, would you meet all of our deficit? We got told no, and that was at the 56 million. So it showed sort of some of the asks would be required, which is why February, I did mention to them it was very unfair, the timing of this, because it has such an impact if we are successful, and so little time for you as members to scrutinise what it then means for the budget, for the services, and the impact it will have potentially on our outturn as well as the MTFS, because they have other authorities last year got a lump sum in the first year which wasn't performance related. So if we get that, then that helps, and that's why in the current monitoring report we are saying if there is some funding that comes through, that will have an impact on our current overspends. So there's so many unknowns at this stage. So the numbers of the MTFS do not assume any safety valve funding, because if we are successful, we will then work our way around that. We're also looking to add into the capital programme the expansions of those additional resource provisions for our secondary and primary schools, as well as the possibility we've asked that we would need potentially a new school, but we would expect capital grant to fund all of that. And that's the reference that Jane then made, that if you are successful as part of the safety valve interventions, you get fast-tracked into some capital. But we had to say whether we needed some capital ahead of finding out whether we're successful or not. So there's lots of things in play as well. So come the middle of January, we may be sort of following up just to say, do you know when we would be likely to hear? So that's all the assurance we can give you at this stage. Sorry, Councillor Holmes.
Thank you. Councillor Byers, did you want to contribute anything at the moment?
I think in terms of Councillor Holmes's first question about the comment about the increase in the overspend, I think it is fair to say that in the past the reason that it is increasing year on year has not necessarily been fully understood, and I think a lot of work has gone on in the past couple of years, certainly when the Chief Executive was responsible for the department, and then under Jane's leadership to really get on top of the reason. And I think until we did that, it was very difficult to come up with a plan to turn the tap off, if you like. But we have had to put forward a lot of detail in the safety valve discussions to demonstrate that we do have a plan to turn things around, and that work has been done by Caroline, Jane and others. So I think there is a plan in place to address that, and I'm sure Councillor Stringer might wish to add to that. In terms of the broader point about thinking through what would happen if we weren't successful, I mean, clearly we need to look at different eventualities. What we need to present in the MTFS is a balanced budget, and in the autumn when the question was asked, I said at the time we hadn't put forward any savings because we still weren't entirely clear on what the gap would be. In this scrutiny round, we've now presented those savings to ensure that the immediate financial year is balanced, but clearly there is a gap in the MTFS in the latter years. But part of what Caroline and I regularly discuss are the different permutations of what would happen without any government support. But even with government support, because as both Caroline and Jane have alluded to, there are so many different combinations of what could happen, even if we are successful, depending on the phasing of the monies that we might receive. And that will clearly have an impact on what savings we may or may not need to present, because we will need to continue to present a balanced budget. So those discussions are ones that Caroline and I have on a regular basis. And I think the answers that Caroline and Jane have given just demonstrate how difficult it has been and continues to be, because we just don't have that certainty. And even when we get the decision, we'll need to then work through what that means and when additional funding might become available in the phasing that would take place in. So that's probably a long-winded way of saying that we do have those discussions on a regular basis. At this point in time, we've presented an MTFS that balances the budget for the immediate financial year, which is what we need to do. But we will need to assess again when we get the decision from the safety valve discussions to see what impact that will have on the MTFS in future years. But Councillor Stringer might wish to add some more on the DSG itself.
Thank you, Chair. Yeah, if I can. And thank you, Councillor Holmes, for your question. So your question was about our statement that without government intervention, it would continue to grow. And I think what we've got now is plenty of evidence that the government themselves recognise that. And that's why they have been working with us on the safety valve, but also with many other, or a dozen other local authorities on the safety valve. That's why they've kicked off again their SEND review, which they started a few years ago when these issues started to bubble up nationally. That was kind of kicked into the long grass, but now it's become so important that they've had to kind of get that going again. So they've recognised that the kind of system as it was leading to kind of higher demands on everyone's services, but without the investment to grow the type of both capital, kind of new spaces, but also kind of do that kind of service transformation, that strategic service transformation that Jane's been talking about, which does require additional funds. So I suppose I think I'm in a rare example of saying I'm grateful that the government have come to that position and have recognised that, and we await the outcome of both the initial safety valve and the capital bids. But I stand by it. We know we need that investment in order to have the deficit not continue to grow. Thank you.
Thank you. I know I still have Hayley with 2 more questions. Has anyone in the chamber got a question? Anybody else got questions? Anyone on? James, did you want to comment on that answer, or is it another question? Yeah, is that all right, Hayley, if you come in after that? Thank you.
Thank you, Chair. It's just a comment. I mean, these things, I've said many times in the past, it's not much fun being in opposition. These things happen. Life is not predictable. And I suspect I'm the least party political person in the whole chamber. But I do think I have a massive regard for Councillor Byers, and Merton is lucky to have him here. And I would say the same about I would say the same on both cabinet members, but I do think that comment of it's taken time to understand the problem, that the problem has not been understood. I do think that comment will potentially come back to haunt his administration. This not understanding has potentially cost £37 million in deficit. And I do agree with what you've said in terms of the rest of the country has faced the same issues. That's absolutely right. But they haven't faced the same issues to the magnitude we have, and most authorities have started to reduce their deficits quicker than we have, and according to the report tonight, did not have as serious a hole as a percentage as we have had. And again, it's just this comment, government that without government support, the deficit is increasing, will continue to increase. And you said, and again, I mean, you've done a really good job in your role, and Merton's very lucky. But you did say in the council meeting, in answer to something I said, you did agree that it was a political decision, that you felt that the provision of the service at the current levels rather than making cuts was important. And in particular, I think it was posts to deal with statements, I think was what we were discussing at the time. So, Chair, I just wanted to make those comments that whilst it's not much fun being in opposition and attacking all the time. I don't enjoy it, but this is a serious issue. And to say that it hasn't been fully understood and to say that we're in the same boat as the rest of the country, when I don't think we are in the same boat as the rest of the country. And I would argue that perhaps it should have been understood earlier, given the massive implications. And Chair, I'm sorry to say, I suppose that comment is to the Cabinet members, but also to our senior officer team. But I don't say that with any pleasure. But thank you very much.
If you can just wait a little longer, because I think after what James has just said, whether Tobin, Eleanor wish to reply, or perhaps either of the directors, Caroline or Jane. So Tobin, do you wish to come in with any comment?
I don't think so, Chair. I mean, I have enormous regard for Councillor Holmes as well, and I think he expresses his points very eloquently. But I'll let, I can see Caroline's got her hand up, so I'll let her come in, but nothing specifically to add, Chair.
Eleanor, did you wish to make?
I'll be brief and I'll come back to it in my kind of updates later, because I think, I mean, again, in many ways, I agree with you, James, but we're getting to the same point. We are an extreme case. We recognise that because we've got particular circumstances, which we have. I mean, a large one is just rising demand and low supply of special school places. That is kind of relatively unique to us. And then what we needed, and this is what the government has admitted, is that additional investment to do that kind of transformation. The political challenge is to make sure that we maintain that quality and maintain the services for the children and young people who need it without kind of rationing care or anything like that. That's my commitment. So yes, we're committing to this 5-year plan with the DfE under the current assumptions, but if in 3 years time, some of those assumptions change, and I don't know, we've got a huge rise in demand on severe mental health, for example, I will be urging us officers to say to the DfE that, we're going to meet the demands of these children rather than commit to this plan that we made to you. That is the political commitment that I'm making. But I'm really confident in the plan that Jane and Caroline and colleagues have put together, that based on our current assumptions and forecasts, we can, with this additional funding, bring things back in line.
Caroline, did you want to come in now?
Yes, thank you. I suppose just to give some context around the wording from my perspective. So when the duties were expanded for SEN to cover 0 to 4 and from 16 to 25, there was no additional funding added to the funding that we got. There are more local authorities now experiencing a deficit and the challenges there. So I think, as it was said, the government has recognised, so it's given an 8% increase in DSG for high needs funding, but it's still not sufficient to cover the increase in numbers and the costs of those places. So that's the challenge, and that's what we meant, and that's what certainly treasurers, societies have been lobbying DfE and are working closely with colleagues at DfE and DULAC to try and get additional understanding from their perspective as to the challenges we're facing, as well as then additional support and funding. Because we're saying just doing 6 authorities a year is not enough to tackle it, because there are some counties with very significant deficits who are still waiting to ask what's the answer. And there is a statutory override which ends in 22-23, and it's not clear. There appears to be some discussions between DfE and DULAC as to how the benefit of that is working. Does it get extended? But it's not answering the problem of the lack of funding for the places in the first instance.
Thank you. Jane, did you want to add anything?
No, I have nothing to add at this stage. Thank you.
Thank you. Can I say thank you very much for that? We're going on to Hayley's questions. now, as no one else has any. Hayley, your other two questions, please.
Okay, thank you very much. Just coming back as well to the previous responses, particularly on DSG, you mentioned that you've already been provided with information for a capital bid. Is that capital bid part of DSG, or is that separate to the safety valve? I wasn't quite clear on that. Just if you could just actually just verify that for me. And then my additional two questions is on page 50, where you actually have savings in future years. The savings for 2023 to 2024 of over 2.3 million looks disproportionate to all the other years. And I wondered what is actually going to happen within that year, because that number does tend to stick out. So that's on page 50. And my final question is, within Jane's report, she does mention about social workers in schools because of government funding for a trial with social workers being in several secondary schools across the borough. Is social workers in schools part of MTFS or not? So will that work be continuing, and is it part of the financial strategy, please? Thank you, Chair.
So shall I pick up? I'll pick up the social workers in schools, and I'll pick up about the capital, if you like. But Caroline, you might want to answer the one about the size of the savings in that particular year. So we can bid for this. So there is going to be some capital release generally nationally around SEN provision, but because we are part of the safety valve discussions, there's a separate process, and so the letter we've been written to ask if we wanted to put in a capital bid was because we are in those safety valve discussions. So that will be additional capital funding for building additional provision, and the proposals that we've got as part of our plan would be around increasing additional resource provision in mainstream school, as well as looking at an additional special school. So yes, it is to do with being in the safety valve plan, and it's a capital bid. It's not. It doesn't impact on the on what they might give us revenue wise, although it does impact on the success of our plan, because part of our plan was based on that needing that capital investment. The social workers in schools is is money we bid for, and are part of a pilot on social workers in schools. So it's not part of the MTFS in terms of ongoing commitments. So that's a pilot program that runs, and then we look to see the success of that. And then if we were going to continue with it, we'd have to look at that being within in the sort of budget envelope that we have.
Caroline, do you want to come in now?
Yeah, so the query on the savings. So back in October, when we updated the MTFS, you'll see on page 48 that the gap for 22-23 was only 1.2 million, but the gap in 23-24 was 17 million, and then 20 million, and then 24. So when we looked at then how we allocated those savings targets, children, schools and families still had the lowest weighting, so 0.75, and therefore their percentage of the savings of the 15.8 million is what equates to the 2.3. So we set savings targets to achieve the 1.1 million, then the further 15, and then the 3 million. So that's why a significantly higher number in that year. But you'll have already seen how the 17 million has come down to 12 million and will be updated further. So the savings that have been brought forward as part of the December papers totals 2.8 million for 23-24.
Okay, I didn't see that.
Total. So this, just because the savings targets were set doesn't mean everyone achieved them, and you can see certainly this time round we achieved them for 22-23, but 23-24 most departments were not achieving their target savings. But as we've said, we're keeping the MTFS under review, and we'll come back again updating in February, and then we'll probably kick starting the process again come sort of June time as well.
Okay, thank you.
Thank you. Has anyone got anything else they want to raise, either in the chamber or those on Zoom? I'd just like to ask, thank you, or say thank you very much for your input. It is quite complicated, and it is of great concern to yourselves and to all of us that you can meet these savings when it seems they are dependent on so many factors that perhaps are not within your control. So I'm sure you have ideas if things don't go as smoothly as you want, but how confident do you feel that you can meet these savings with the difficulties? And the country has got to find the cost of COVID because the money has to come from somewhere. So how confident are you that we will be able to meet these savings in the plan you've got, or they may have to be adjusted, but perhaps still meet your end target? And do you think it's a feasible plan?
If I talk generally, and then Jane can pick up on the specifics. So as I said, the fact that we actually took out some unachievable savings, I think the savings that have come forward at this stage, we have asked directors and sort of my direct reports, myself in my own area, to make sure the ones that are coming forward, because we're aware of the impact that COVID has had on services, on staffing, on resources required, to make sure that we can deliver these. Because I will want to sort of bank these as much as possible. However, we will keep them continually under review. You'll see in the actual savings details, the deliverability impact. So I don't think there are any that are high. So that gives me some assurance. The plan, it is a plan. It's not accurate. The numbers will constantly change. As soon as we put the budget to bed, there will be other things that will come through. So that's why we constantly review, keep it under constant monitoring and report changes back to you. And the example of the one that we did do was obviously the change to the emissions-based charging. So we completely reversed that saving out. So it had an impact on monitoring, impact on the MTFS. But that's part of the process that we've built in to show how seriously we take it, looking at the impact on services, the impact on residents, and the impact on staff to be able to deliver this. But hopefully give you some assurance around, we still expect to be able to deliver that balanced budget for 22-23, but it won't necessarily be in the way that we have currently set it out now. Thank you.
Jane, did you want to come in?
I just add to what Caroline said. So I think we were all really clear that the savings we were putting forward, we would feel were achievable. So yes, the savings are put forward for the following 2 years. We believe are achievable.
Can I say thank you very much? It is a huge task you have in your hands, and I have every confidence in your ability, Caroline. I have great respect for you, and I try to understand it, and I do certainly bits of it, and each year a bit more, but never, I feel, am I completely on top. But thank you very much for your input and your explanations, this, along with Jane and Tobin and Ellie. It's very much appreciated how you're answering our questions, and let us hope all the funding comes through, and we do need more funding. And Jane, you made it very clear, I can't remember which meeting, but since they changed the boundaries of the EHCPs from or with one age range to the other, going from birth to 25, it makes a huge impact, and it takes out of the overall education budget, and it is massive and has to be. Those children deserve it. That's not the question at all. They deserve it, but we deserve to get the funding to provide the very best education we can for them. And thank you very much for what you're doing. And thank you, Caroline, and have a lovely rest of the evening.
I was going to say thank you. I'll take my leave of you now, if I may.
Thank you. Tobin, are you staying on?
I'm not. I'm also leaving. Thank you, Chair.
Well, thank you very much for your
if you'll
input.
excuse me.
Thank you.
Yeah, I do excuse you. All right, thank you. Right, if we can go on to the, whoops, we tear bits of paper off. So item agenda 6, the departmental update, please, from Jane. Thank you. It's on the supplementary agenda.
So, Chair, the only thing I thought might be worth just adding at this point is obviously I did send an email around to all councillors at the beginning of this week just to update on schools, because I know councillors will be interested in how our schools are managing coming back. And as you will know, just before the beginning of term, there were some changes to guidance. So, for example, about secondary pupils and staff wearing masks in classrooms as well as in communal areas. We had testing of secondary pupils before return in the first week last week, and last week obviously also some schools had some inset days. So really not until this week, towards the end of this week, will we get a fuller picture of attendance. But we do know that schools are under some considerable pressure in terms of staffing, and that's a combination of staff who are unwell with COVID, staff who are unwell for other reasons, unvaccinated staff who may have to isolate because they have been in contact with someone who has tested positive for COVID, and there is a very limited availability of supply cover, but our schools are doing an amazing job in trying to manage all that and really limit the amount of disruption there is to children's education. But they have done some preparation with pupils and parents around any possibility of returning to blended learning if that is necessary. But at the moment, we certainly don't have schools that are not open or whole classes that are not there, and probably our sort of our biggest concern probably is in our special schools, where we have more pupils that are vulnerable, as well as staff that might not be there. So we're just keeping an eye on the situation as it is, and it may be that the councillors have further questions around that, and I know that Elizabeth will have sort of more detailed information about schools if that is needed. But I think that's all I wanted to add, and then take any questions on the departmental update.
Thank you. Are there people who have questions? James, Dennis, Joan, anyone at home? Sorry, Hayley, sorry. And can I apply the same process that if you've got several questions, you just ask to let me know and I'll come back to you later. So James, please.
Thank you, Chair. There's lots of, I just wanted to flag, there is lots of good things in this report, particularly page 4 to 17 onwards, really good, all of that, and into page 5. So I just wanted to congratulate officers for that. Although 2.19, I wasn't mean enough to look it up, but I have a feeling that might be the same wording that we received before. But that was all good. Just two questions, Chair. Under 2.4, and I have raised before that this does concern me. So 2.4 talks about page 2, talks about the tragedy of the killing, the murder of 2 young children. And it quite rightly talks about the shock and the anger and the sadness around it, quite properly. And there's also a thanks to members of staff who are involved. But Chair, to us as scrutiny, that there's only a few words that we can scrutinise, which is that the officers will reflect on our own work with children and young people, and Chair, that's the critical part, and it is really only whatever it is, 6 words, 8 words in that whole paragraph. And I have said before that I wish that we could have a bit more detail on so that we can scrutinize. So my first question is 2.4. What reflection has been done on work given these tragedies that has happened in a national context? What form has that reflection taken? How has the director measured that reflection and what has been the results of that reflection. And it's that information that we really need as councillors. I mean, absolutely, it is shocking and it makes us angry and sad, absolutely. But as a panel representing the residents of Merton and only meeting a few times a year, what I really need to understand is that reflection and what form it's taken. And my second question, and this isn't to detract from the fact that there's lots of really positive stuff in this report, which is really exciting. My second question is page 6.2.29. Could I just have some explanation there? So 4 schools, and again, this is the sort of detail that we actually need in order to be able to scrutinise. So the report says that 4 schools have been inspected. And then it refers to 2 schools that are listed in the report. So are those 2 schools, I mean, the report, it reads, there have been 4 schools inspected during the autumn term. These were in the order anticipated by Merton School Improvement, and the 2 published reports match the MEP's inspectors' evaluations and the impact of MEP support over the last academic year. I do think Sir Humphrey Appleby would be very impressed with this wording. But what does it actually mean? I mean, what was the outcome at those 2 schools? And are they the 2 schools that are then talked about? And if they are, then what about the 2 missing? And if they're not, well, what was anticipated and what happened? Because unless we know what was anticipated and what happened, again, Chair, we simply can't scrutinise. And I have raised this before in these meetings and with the director. I am concerned that quite often these reports give us a lot of information, but not always a lot that we can actually scrutinise. Thank you, Chair.
Thank you. I don't know, Jane or Elizabeth, who wants to take it.
Well, so I'm sure Elizabeth will pick up the second one, but to come to the first one, so I suppose there'd be 2 things in answer to Councillor Holmes's questions. So the first one, in terms of the reflection, is that actually it hits social work staff and staff across the safeguarding system really hard when these things happen, and it makes us reflect in the sense that we reflect all the time, but it makes you focus in even more clearly. So I guess to outline some of the things we do on a regular basis and that we would just have particularly looked at. So for example, we went in and checked every single virtual visit that had taken place and the reasons for them. There were very few of them, and the reasons for those and the management oversight of those, to reassure ourselves that we were keeping a close eye where we weren't able to get into a family, and just to reiterate our expectation that all visits will be in-person visits unless there's an exceptional reason. We look at the data across our system on a weekly basis to see the number of open cases we have, visits that are taking place within timescale. And then we look at that on a monthly basis also to see month on month what's happening, the flow through the system, how many referrals we are getting in, how many of those might be most appropriate for early help or coming through our system. So we look at a whole range of indicators on a regular basis, and what often these cases make us reflect to do on is there anything more we can do? Is there anything different we can do? And what are our relationships like with our partners? Now we have very strong relationships, for example, with our schools. So we keep a close eye on those children who are not attending school. And so, again, one of the things that we've been discussing this week is reinstating our children missing education, additional panels that we had during lockdown, where actually we met and discussed every child open to a social worker, and we checked whether they were in school, and we supported social workers and schools to get those children into school or to understand what was happening for those children. And we're extending that this time to any cases that are open to our targeted early help service. So we just look to see whether there's more that we can do to assure ourselves that we're doing everything we can to try and keep children safe. So I hope that provided some reassurance to you, Councillor Holmes.
Yeah, just very briefly, I mean, that's a fantastic answer. So thank you very much to the director, but that's not what was written. So that's the comment that I've made, that I would make to you as chair, but also to the director. And I have mentioned it to both of you outside these meetings as well. But I mean, that's a fantastic answer. So these tragedies have taken place, and now we as councillors can be satisfied that the director and her team are absolutely on top of it, as in fact I assumed you were, absolutely on top of it, doing all we can to make sure the same doesn't happen here. But that's not what the report says, but it is what the answer is. So thank you very much.
What you really would like is more detail in the written report. Is that what you're saying?
Fair to the director and to you, I've said the same to previous directors and previous chairs over a number of years. So the voters will decide whether I can continue to say the same thing over the next few years. But yeah, I mean, that's my comment, that the answer is absolutely brilliant. I mean, that's really good stuff. But sometimes the reports don't say that. We know that it's sad, we know it's a tragedy, but actually what we need is a scrutiny panel representing our residents and only meeting 6 times a year is the answer that's been given. And then we can tick it in the box and say, good, we're on top of that one. Thank you.
I think also much of it comes down to, if you write everything in detail, the report becomes so long that people perhaps don't read it as carefully as one would want them to read it. It's getting that balance is difficult. I agree. Yeah, but thank you.
And then my second question as well.
The second question, please.
Thank you, Chair. I'll answer that question. So with apologies, Councillor Holmes, for perhaps the opaqueness of paragraph 2.29. Just to clarify that the 4 schools were inspected. So we've got 2 published reports. The reports, which are indeed the reports for Links Primary School and the Priory Church of England Primary School. The other 2 reports are not yet published, so the judgments are not yet in the public domain, and hence we're unable to comment about them in the report. I hope that is helpful and answers your question.
Absolutely it does. Thank you very much.
Thank you. Dennis.
Yes, thank you, Chair. I think it only leaves me with 2 questions, so just as well I can have 2. 2.5, this impact of the pandemic on younger people in schools being helped by Rutledge School and so on. My question is that when this ends up at the Children's Trust Board, have any of it always seems to me that this report is just secondary schools only. Is there any part of this that involves primary schools? And if not, what happens when when year 6 end up at secondary school this year? They won't know anything about what's being done on their behalf. And my second question is 2.8. The healthy partners and the local authority continue to respond to recommendations following the SEND area inspection. Well, it says that those recommendations were made in 2019, and I assume that we would take them on board and actually implement them. But has any of the recommendations had to be altered because of the pandemic? Because these were made pre-pandemic, and I would suggest that quite a few of the targets that we're looking for have been changed because of the pandemic. And have they been put in place before there is a 2-year review?
So shall I pick those up, Chair?
Yes, please. I assumed you were. Thank you.
Okay, sorry. The survey of young people included pupils in year 5 and year 6. So it wasn't just secondary. So hopefully that provides reassurance there. In terms of the SEND area inspection and the written statement of action, so the areas that we have under the written statement of action those areas wouldn't change because of COVID. They were to do with the quality of education, health and care plans and the advice in those, particularly from a health perspective, and the strategic oversight, again, particularly linking to our work with health colleagues. So we continue with those specific areas that were part of the written statement of action. And we continue focusing on those until we have our re-inspection to make sure that we are continue to develop those areas. But we also have a full SEND strategy, and the actions within the SEND strategy we do look at on a regular basis, and we will again look at our SEND strategy to reflect some of the actions that will come from the piece of work we've done around the safety valve, around looking at sort of strengthening SEND support, for example, and also to reflect the impact of, for example, pupils' mental health. So the action plan around the SEND strategy is reviewed on an annual basis, and those are updated. But the specific areas that we had to work on from the SEND inspection, we will be re-inspected on. And we're expecting that inspection at any point will be re-inspected on those specific areas. So that's why we continue to focus on those areas with colleagues across the CCG and with our community health providers.
Thank you. Joan.
Okay, thank you both for your report and Happy New Year to you. I have been looking through your report, and there's something I want to ask, but I haven't seen it here, but I'm just going to ask it. I just want to find out if all our secondary school spaces are filled, and if not, why do we still have family with children on waiting lists, wait to be, get school space?
Thank you.
Well, I can probably start that one, Elizabeth, and then you might be able to. So all of us, we do have some spaces within some of our secondary schools. So I'm not quite clear what the waiting lists are. The waiting list could be because that's a preference waiting list, and parents have been offered a place at another school that they don't want to take up. But we do have places available within our secondary schools for applications. I don't know, Elizabeth, if you want to.
Yes, I would be unable to provide specific numbers, but absolutely there would be some spaces, but they are likely to be at a low level, just to reflect that our secondary schools are full on entry into year 7. And so what we are looking at is spaces so we would be looking at, in the vast majority of cases, children who are moving schools, and as a result, those spaces become available. Yeah, so it's the waiting list, I think you would refer to as Jane says.
Thank you. Hayley.
Yes, just two small questions, if I may, Jane. You mentioned in your report about a youth voice survey, particularly in terms of with children within the pandemic. I think it's within section 2.5. You mentioned that the findings and recommendations were actually taken to I think it was the Youth Voice Committee. I can't remember precisely. I've made a note. I'm just wondering whether or not that'd be quite useful information just to see how children have been affected. Obviously, not anything personal, but if you're making recommendations and there is a summary of those findings, I was wondering whether or not it might be useful for panel members. And my second question, I know that James referred to this part of the in terms of with this session with Caroline earlier, but I was interested. I know that it's only just closed, but I was just interested to find out how many families did actually engage on the webinars and the online survey for the transport consultation. So those are my two questions. So the first one's on the Youth Voice Survey and the amount of families that chose to get engaged with the transport consultation, please.
Okay, so we had some young people come to talk to the Children's Trust. It was where they did their some feedback on that, and they came to talk to the Children's Trust about the initial findings and some of their thoughts and recommendations, so that the Children's Trust could think about that as they were pulling together their next year's plan. So those are being pulled together into a report format, and absolutely, I know panel members would be interested in that, so we'll make sure we include that in the include some more detailed information about that in our report in February, because it's only about a month till we meet again. And I've just already forgot. Oh, right. So in terms of the transport, now I'm just thinking, and I'm looking to Elizabeth, because I think we were told this morning by Tom, but I haven't got that presentation in front of me.
Likewise, I'm afraid I haven't got it. It will certainly be part of the report that comes to scrutiny next month again, though.
So we had very high, very high level details came this morning, because Tom had literally just sort of looking at how many people responded, but it was in the hundreds of people, I think. So anyway, but I'm sorry. So let's not make that as a.
No, I understand. Don't worry.
Yeah.
Okay. Thank you, Chair.
Councillor Stringer.
Thank you, Chair. I was just going to chip in quickly because I attended the two webinars that were organised, thankfully, by Kids First, who were brilliant. And I can't remember the exact numbers, but there were kind of at least a dozen young people on each of those, not young people, a dozen parents and carers of young people on each of those responding. And they were really, really engaged. And it was, I found them really, really fruitful discussions.
Thank you. Nick, you have a question? Oh, sorry, just. We can have Nick, then Mansour. Sorry, I couldn't see.
Am I asking my question now?
First, yes.
Quickly, Chair. I understood Councillor Joan Henry's question. I'm pretty sure there is an answer to it. I'm afraid to say I didn't understand the answer. And that may be to a certain extent down to me, and for which I apologise. But it's a simple question. I'm sure there is an answer to it, but it's an answer that we as councillors have got to be able to give out to the people of Merton when they ask it to us, and they will require a simple answer and one that, you know, somebody the likes of me can understand. Thanks.
Thank you for that. I will add, with children moving as they're in their secondary education, and with Brexit, we have had people leaving the country, and with COVID, we've had people moving out to the countryside. So it has had an impact. So I know that there is a record kept of the numbers throughout all the schools, but it will be probably regularly changing. And I don't know, Jane or Elizabeth, if you can give a more concise response.
So I think perhaps some of the vagueness might be because we don't have those particular precise figures in front of us. And I think for February report, we can undertake to make sure that you have those precise numbers. And we can talk also in that report about waiting lists.
But it would be helpful, Chair, in the meantime, if councillors have got specific issues about cases that they are concerned about, then do let us know. But in general, we would get children into school as quickly as possible when they're arriving, and we know that certainly we've got spaces throughout year groups other than year 7. We know year 7 is likely to be tighter because we had more preferences for our school places, secondary school places this year, and so year 7 is more or less full. But I'm not aware of there being waiting lists or people waiting, so that would be really helpful if you could let us know if we've got anyone stuck in the system.
Thank you. Mansour.
Thanks, Chair. Thanks, Jane, for the departmental update. My question is 2.23 of page 5. It's regarding impact of the Early Help Summit organized by the Merton Safeguarding Children Partnership.
So it was a well-attended summit. It was so during the summer term, there'd been a launch of the early help strategy and the new effective support model. So it was a meeting to engage with partners around that, looking as we do to improve that sort of early help journey. So it was well attended and very positive feedback from partners. So there was the beginning of a piece of work that will be ongoing throughout the next 6 to 12 months around looking at that sort of new early help strategy. So it went down it was very positively received.
Thank you. Thank you.
I have 2 more questions. Russell, then Omar. Thank you. I'm sorry if I'm looking at the screen, I miss it. Omar then, thank you.
No worries, Chair. I'm hiding behind the lights, so you can't see me as clear. Thank you, Chair, and thank you, Jane, for providing the update. I have 2 questions. The first one's in relation to the transport consultation. What I wanted to initially ask is just how many children are we currently transporting from those 3 schools that I mentioned? When will the outcome be presented to this panel? And then my second question is in relation to 2.33. We mention actions that have been pulled together by these ambassadors. However, what are the actions? Are we able to have them shared?
So I'll pick up on the transport consultation, and Elizabeth, perhaps if you could pick up on pupil ambassadors. So the findings from that consultation will come back in you've got a report planned for the Open Scrutiny panel in February, so to your next panel. And I can't off the top of my head tell you how many children we transport in each of those schools, but I can get that to you as a response following the meeting. And Elizabeth, do you want to pick up the second bit?
Yes. So at the moment, those what the ambassadors are going to be coming to our Black Lives Matter and Earth Qualities Forum. We don't yet have that sort of report that they have prepared, their manifesto. So although that is only a week away, we haven't got it finalised yet. So I'm not able to share their key points. I mean, I think it's just to reiterate again, it was a very successful conference. I think the young people involved felt very listened to and found it a useful experience.
But again, we could bring that, we could report on that in the next report then, couldn't we? In February?
Indeed, we could, yeah.
Thank you. Yeah, that was going to be my next ask, whether we can actually bring that in the next update, which I think would be useful. Thank you.
Yeah. Thank you. Russell.
Thank you, Chair. In the next report, could we have an update on the school places planning strategy that we did in September? I presume we are going to suffer from the same lack of birth rate for next year as we did last year, and the schools will need to know, particularly the primary schools, how they're going to cope with that for 2 years in succession now. And the earlier we can tell them, the quicker. So can we have an update on that, please?
Yes, we can certainly provide the information that we have at this stage in terms of providing that update, yes.
And you'll put that, various items have come up, but if you can make sure they're included in your next report, that'd be very, very much appreciated. Thank you very much. Anybody else got another question? Joan.
Yeah, thank you. Okay, thank you. On page, I'll put my glasses on, good. On page 6, 2.9, update and offset. Can you just give us a little more details on the outcome of the offset report, please?
So, Councillor Henry, so as I previously referred to, so we've had the 4 schools inspected and we've got the 2 reports. The 2 reports speak of many positive things in both schools and also give them areas for development. Those letters have been published for parents and the community to see. Councillor Henry, I'm afraid I don't have those reports in front of me, so I can't give you the detail, but they are indeed in the public domain.
So Councillor Henry, once in the public domain, you can go in and look them up and read the detail or aspects of the detail that you want. And I'm sure we're here when the other two are made public. Thank you very much. Are there any more questions? Or can we move on, please? Right, thank you very much. The next area is the Cabinet members' priorities. So Eleanor, over to you.
Thank you very much, Chair. And I'll try to be brief, and not least because, thankfully, all the priorities that I was going to raise are things that either have been mentioned by officers or in fact, been mentioned by members here already. So I'm glad that we're all aligned. So the first one of those is about youth voice. That obviously was much kind of harder over COVID, but we've been doing some brilliant work on youth voice over the past few months, and I'm really keen to support that and keep that going. So that includes things like the survey that we've talked about. So as we said, we haven't published the findings yet, but we have made sure that those findings have fed into the 2030 work that the council is doing, because I was really keen that the strategic work at the council wasn't just informed by the big Your Merton survey, but had the voices of children and young people in it. So when you see that coming through, you'll see it references some of the kind of findings coming through from children and young people. I mean, at a headline, you'll be unsurprised that the things that children and young people care about are the things that we all care about. So it is about things like, our parks and green spaces. It is about their mental health. It is about worrying about kind of food poverty and things like that. So really keen to support that. We've also been doing some brilliant work getting young people and children involved in our other kind of governance groups like the Corporate Parenting Board, where we now make sure that we hear from children who've had experience, young people who've had experience of being in care. So I'd like to thank Jane and her colleagues for pushing on that. So youth voice is one. The second one is schools, which is the two main concerns of mine about schools at the moment. They've both been focused already. One is Ofsted and one is place planning. So they're the two big concerns for me. We're going to have a lot of Ofsted inspections coming through. We've talked already last time about how Ofsted have now publicly said that they are looking to reduce the number of outstanding schools. And, had a discussion last time about how we don't want to in any way become complacent in Merton, and we want to have our expectations high. My kind of third area is the kind of broader children's social care area, which comes to what James was highlighting about the kind of reflections of the terrible cases in December. I think you're right, James, that I don't feel that we talk enough here at this scrutiny meeting about the kind of nuts and bolts of what happens in children's social care and in the early help to prevent kids getting to that point as well. And it's not an area that I have had as much kind of professional experience in until recently, and so I've been getting more, want to get more involved in that, and I'd love to discuss that more widely here. I suppose the one thing I would reassure you about, James, is, like I say, there are lots of other governance arrangements that are focused on that, like the Corporate Parenting Board, like the Merton Safeguarding Partnership, which Jane has done great work on. We've got a new chair of the partnership, and that's in a much stronger position than it was. And then my fourth area I won't go into because we've talked at length about, which is SEND. And for me, as I gave in my response earlier, it's about the tension between, yes, ensuring that we've got a plan that is achievable and sustainable and comes within costs, but ensuring that we are not just kind of maintaining quality, I think is a phrase I used earlier, but actually improving the services that we're offering for children and young people, so that we should have the same expectations for the outcomes of children and young people, no matter kind of what additional needs and supports that they have. So they're my four areas: kind of youth voice, schools, SEND, and kind of wider children's social care. Thank you.
There's a question. If anyone else has, can you let me know, please?
Thank you, Chair. So me now, yes? Thank you, Chair. Just two comments on the Cabinet members' report. The first is that I'm not disagreeing that this work is being carried out. I think we're very lucky with the officer team we have in Merton, and the results show that. that we have a good team. That my frustration is around the scrutiny process and the reports we're given and the opportunity we have to scrutinize. That's where my frustration is. It's not actually that I don't think these things are being done. I think luckily they are. It's just that I don't think, I wish that scrutiny could be done slightly differently. And secondly, Chair, I just also wanted to say to the Cabinet member that that I very much respect her for standing by her principles, and I don't always agree with them. And tonight we've talked about some decisions that the Cabinet member has made around the DSG that I don't agree with, but I do very much respect the fact that that Councillor Stringer has a set of principles that she sticks by, and regardless of the flack that she gets, whether it's from me or from others, she sticks by those principles. And I just wanted to say that I do very much respect that. Thank you, Chair.
Thank you. Has anyone else got anything they want to add or ask? Right, thank you. We'll move on to the next item, agenda item 8, which is the performance managing report. And Carl, are you there for us?
Certainly am.
Thank you.
Chair, and good evening and Happy New Year to everyone. So as ever, this is the performance update that members see on a regular basis. You have a cover report which indicates in section 2 those indicators that we are showing as read, together with a summary of the service commentary, and you are also provided with the scrutiny and data overview. For the quarterly indicators, it's up to the end of Q2, which is September, and for the monthly indicators, we've gone up to November 2021. And I guess in time-old fashion, happy to take any questions.
Thank you, Carl. Thank you for your report here. Has anyone got questions for Carl? We've got James. Is there anyone else? Anyone on Zoom? Okay, James, over to you.
Chair, I have been very frustrated with this report, as you know, in the past, but I just wanted to say thank you to Carl, because this is, I do think this is an example of how we can evolve, and to see this report with commentary again, and actually talking about the issues and what we're doing to address them. I really think it changes this whole agenda item. So thank you very much for that.
Russell.
Thank you. That's good to hear. Thank you.
Can I just ask a question, Carl, that out of these red ratings that you've got, number 16, 19 and 21, are they based on time doing these things? And if so, do we have control as the council of the time that's spent?
So what I will do is I'll talk about the indicator, and then I might invite Dheeraj in to talk about the practice. So indicator 16 talks about the number of weeks it takes to complete care proceedings. So this would be after a decision to instigate processes where concerns are of such magnitudes to consider removing a child out of their existing family context. So that is indeed a time target. And your question was interesting, because you said, how much can the council control this one? This has been one where in many ways we are reliant on court time. So we have seen in the pandemic this indicator rise nationally. So most local authorities have seen an increase in this indicator, purely because courts weren't able to sit in the time-honoured fashion that they were used to pre-pandemic. And I'm sure there's more detail in terms of how I think it's the West London Court, which we use, has adapted to that. So that there is indeed a time factor there, and actually a degree of control that sits outside of the council. That doesn't mean to say we're completely at the behest of the court. It also means that we need to really think about our strategic engagement with the court and how we ensure that our needs as a council are met by our friends in the judiciary. In terms of the stability of placements, it's less about time. This is the indicator. What the indicator describes here is whether or not a child has moved 3 times within a year. So it's obviously, it takes an indicator now and looks back for 12 months and looks whether or not a child has had 3 or more moves. And as you would imagine, that gives you an indication when you look at that as a percentage of your overall cohort, how stable your placements are. And that in turn gives you an idea of how, or at least it allows you to have a line of inquiry in terms of how well your placement decisions are matching the needs of the child. If you take as the basis the basic assumption that you would have a stable placement if you manage to match the placement with the needs of the child, you would have less placement moves. So therefore, if you have a high number or high proportion of children with 3 or more moves in a year, that would give you an idea of, I guess, or it would enable to ask some questions about that placement process. In terms of the degree of control, I guess we have a higher degree of control here, although there's obviously a market sort of element to this, particularly when we look at children's homes provision and closeness to home and those types of things. So, but again, it's not absolutely that we're completely at the behest of a market. It's about how, as a council, we shape that provision and we really think about how we match the needs of our children to the provision that is available. And did you say it was 21 you also asked about? So this is less about time. This is more about children who are placed with our in-house foster care. So this would be the foster carers that we have recruited as a council. And in terms of the degree of control over this, that probably is the one where we have, I guess, the highest degree, because this is about our recruitment of foster carers and how we then place children with those in-house foster carers. So what we're reporting here is that the proportion of children in our care who are placed with our in-house foster carers isn't as high as we want it to be. I think we set ourselves a target of 60%, and I think we're just under 50%. However, it's in the context that actually overall, in terms of placement with foster carers, Merton is actually ranked very, very high compared to its London peers. So, and again, that tends to be an indication of good practice, where we have a less reliance on children's homes or semi-independent accommodation and more reliance on foster carers. Dheeraj, is there anything else? I've tried to sort of describe the indicators, but maybe I've strayed a bit into self-practice as well. Is there anything you wanted to add?
Thanks, Carl, and thank you, councillors. Can I just check that everybody can hear me? Okay, perfect. Thank you.
We can hear you. Thank you.
That's really helpful. Thank you, councillors, and thanks, Carl. I think Carl's given a really good explanation about the various indicators. From a practice perspective, so if I pick up indicator 16, for instance, there are a number of things that we put into place in trying to deal with the average time that we see a case or a child's case progress through the court system. As you know, and as Carl's already highlighted, there are some interdependencies with courts' timescales and their availability, which has nationally been a challenge, particularly during the pandemic. So some of the things that we have to put in place and we strictly monitor through the council is proportionality, so ensuring that the right cases get put through the court system. And only those cases that really there is no other alternative. And as a result, Merton has seen a relatively low number of cases going through the court system, and that in itself sometimes can be problematic, because the lesser the number of cases, the more skewed the figures become, especially if 1 or 2 go beyond that period of time. And there are some complexities that we deal with around expert assessments and timescales of experts providing their evidence to the courts, which also impact on those timescales. In terms of placement stability, again, as Carl's highlighted, it's about the number of placement moves children face. We try and keep that to a minimum. So there are, again, a number of processes we put in place. Again, proportionality, ensuring that children are placed in a planned way, at the front door when a situation like this arises. The officers work closely together to identify the best type of placement and the matching process begins. And the better the matching process at that point in time, the less chance of a move. And where there is a need for a move, again, that's scrutinized, and as far as possible, we would put support in place to prevent that move from happening. And in some situations, that can't be avoided. In terms of percentage of children looked after in foster placements and in-house, again, that is an indicator, as Carl's mentioned, that we're working hard on. Councillors will remember, I think it was my second week in role, and we had the presentation from Mockingbird, from a Mockingbird carer and from the fostering team, providing some strong evidence around the positives of that process and the satellite system that's created through the Mockingbird program. And actually what we're starting to see is a slight increase in recruitment, a slight increase in those children in in-house care provisions. And that's something we're working hard to continue to try and achieve. I also should have said, apologies, my camera isn't working today, so I'm not trying to be unsociable, but hopefully by next time my IT issues will have been resolved. I hope that's answered the councillor's questions.
Thank you. Your contribution is appreciated. And yes, we hope the camera, so we can actually see you, is working. Are there any other questions from anybody on this area? Anyone at home? No, I've seen you, Russell. Just checking anyone at home as well. So Russell has another question.
It's really a follow-up to what Carl was said about indicators number 16. Is it possible that we could show it as totals of numbers of people rather than percentages? I say split it between over 26 weeks and under 26 weeks. That would mean that in the case of skewed figures, we would know that, say, 2 out of 5 have gone over 26 weeks, and the reason for that is so-and-so, and that would help, I think, in the scrutiny process that we do.
I think that's a really helpful challenge, actually. So we, what we could do. So this talks about the actual weeks. So the numbers you see in front of you is the number of average weeks. However, you're absolutely right. If we're saying that this pertains to small numbers, I think it's a reasonable challenge to say actually how many could we have the numbers. So, and I think we should be able to provide you with that for the next time. So I'm happy to work with the service to give you the numbers that are currently going through the court processes and to give you an idea of the scope.
That'd be very helpful, thank you. And the stability placements one, number 19, have all those moved within Merton or within foster carers that we've got availability for?
So I think that's a twofold question. So the 3 placement moves. So the first thing to say, it's for Merton. It's for children who are in the care of Merton. So for whom Merton is the corporate parent. So we have children from other boroughs being placed in Merton, and we would equally be placing outside of Merton as well. So this indicator talks about Merton children wherever they are, wherever they are placed. So it could be, and it could be across any type of provision. It could be a move from a foster care to another foster carer. It could be from a children's home to a foster carer. But it's the number of placement moves that is the critical bit. If you really get into the detail, there are certain things that we do exclude. So this would be a hospital admission, for instance, counts as a placement move. The way this is sort of counted, we tend to exclude that where it's generally for an operation, for instance. But we wouldn't if it's, for example, for a longer term illness, for instance. So there's some certain decisions that we take in terms of include and exclude, so that we get a reasonable idea of what could constitute as a placement move. But it pertains to all Merton children, regardless of where they reside geographically. Did that answer your question? I'm hoping that it did.
That answers the questions I asked. I've got a slight question that I'd like to ask on that. I'm not sure it's going to help, but
okay.
If a child is fostered in Sutton, and they're a Merton child, when do they become a Sutton child? Or don't they become a Sutton child? They're still a Merton child until they're out of the foster system completely.
They would be, yeah, they would be, as far as I'm aware. But again, I will defer to Dheeraj. Actually, I'm not aware once a child has been made. It's the I'll defer to Dheeraj actually to answer that.
So yeah, I can take that question, Carl. Again, just checking everybody can hear me.
Yeah.
So for children that are subject to care proceedings, and Merton has subjected them to care proceedings, and as a result secured an order, in those situations, the care of the child remains Merton's responsibility. In fact, if we've placed a child under Section 20, which is voluntary accommodation, even then that child remains Merton's responsibility. In some very unique set of circumstances that have emerged in recent years around unaccompanied asylum-seeking children, do we have some opportunities to consider cross-border transfers? However, not for the vast majority of the children that we look after. I hope that answers the question. So once our child remains our child.
Thank you. As there are no more questions, Carl and DJ, thank you very much for your input. It's appreciated, and things are looking good, and it's great that you're keeping an eye on things that need to improve. So thank you very much. Thank you.
Thank you.
Our final agenda is the work programme, and we have 2 meetings left in February and 1 in March. The agenda set out there, and we have already asked for certain issues to be included in the next meeting coming from Jane McSherry. So I think we've agreed that that's going to be included. So that's our work programme. Can I thank everybody in the chamber for coming, and those who attended by Zoom? Thank you very much for joining us. And if you're at home, lucky you. And for those of you